To start, we just want to give a land acknowledgement. So just want to share that with everyone. So we acknowledge that the land we work on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis peoples. We acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is situated on the traditional territory of the Haudenosaunee, the Huron-Wendat, and the Anishinaabe, and is still home to many Indigenous people from across Turtle Island, as well as settlers who came involuntary and enslaved African people who were forcibly brought to this land. We honor all ancestors and are mindful of broken covenants and shall strive to make this right with the land and with each other. So to start, I just want to do some introductions. My name is Gillian Dennis, and I am currently Trustee Engagement with Delta Family Resource. I'd also want to introduce Charlton Elliott, who's the Community Development Officer with the City of Toronto, and also Kemi Jacob, who's the Executive Director for Delta Family Resource. Okay. So we have a bit of an agenda for this morning. So let's just quickly go through the agenda, and then I'm going to hand over to Charlton, who's going to take us through the city's initiative. So just very quickly, we've done our welcomes and land acknowledgement. So we're going to talk a bit about, so Charlton's going to talk to us about the City of Toronto's TO WARDS Peace Initiative and look at partners, the initiative launch and timelines. And then Kemi's going to talk more about the TO WARDS Peace Caregivers program, which is going to be rolling out in Jane Finch and Rexdale. So we'll be looking at the purpose, the target groups, the program, and partnering with Delta Family Resource for those groups who are who've been awarded funding. I'm going to take us through the actual request for proposal document. So we're calling this request for proposal 101. So really sort of going into a bit more details about that document. We're going to look at eligibility, budget and staffing, the grassroots experience required, eligible costs and ineligible costs. The application form itself, we're going to sort of drill down through that. So if you have any questions, there'll be an opportunity for you to, if something comes up, particularly during the application piece, do feel free to, just say, hey, what does that mean? A little bit about the timelines, the review committee and next steps. And then obviously at the end, we'll have question and answers if there's any additional questions that you want to ask. I mean, we're a small group, maybe others might join us throughout the morning, but if you do want to jump in, do feel free. Okay, so now I'd like to hand over to Charlton, who's going to take us through the City of Toronto's initiative. I'm going to stop sharing. Right. Are you on?
Can folks see my screen?
Yep.
Yeah.
Perfect. Thank you for that introduction, Jillian. Okay. All right. I think we are good. Okay, so for today, I just want to talk to you guys a bit about Towards Peace. Basically, what the project is, a little bit of an overview, where it came from. I'm going to talk about the development and implementation, followed by all the partners that are involved in this initiative. One thing to understand about Towards Peace is that the public health approach is really embedded in everything that we're trying to do. So kind of speak to what the public health approach is and how it works with Towards Peace. Followed by the 3 main methods of engagement, and then finishing off with who we want to reach. At any point, if you have any questions for clarity, please, I don't mind if you interrupt. Gun violence, as we know, is not a singular issue. It is a complex, multifaceted, and the result of trauma, socioeconomic inequities, and systemic barriers like poverty, mental health, and access to employment and education. Existing programs tend to focus more on prevention, reintegration, or emergency responses, which leaves a huge gap for those who are currently involved or most vulnerable to violence. Towards Peace aims to increase effective interventions to mitigate violence in the Northwest using a risk-driven multi-sectoral model that is driven by a community-centric public health approach. Towards Peace will contribute to the advancement of Action 2.1 of the SAFE TO, a community safety and well-being plan. It focuses on the collaborative efforts between local grassroots organizations, community health centers, hospitals, and the City of Toronto to address the interruption, intervention, and prevention of gun violence. Just to speak on the context of how Towards Peace has kind of been designed and developed, it's important to understand this initiative was part of the city's multi-sectoral approach to addressing the escalating incidents of community violence and its impacts. The concept was first proposed to Toronto City Council in 2018, and then the directed investment to develop Towards Peace was approved in 2019. As I previously mentioned, the pilot is a risk-driven integrated intervention model that really looks at mitigating community violence first through violence interruption, and then secondarily through intervention and prevention. Gun violence, as we know, is disproportionately experienced by Black communities, impacting youth, their families, and of course, the broader community. In building this model, there was a deep understanding that it had to really look at being trauma-informed, as well as culturally appropriate. That would be the only way to effectively address how anti-Black racism, historical trauma and oppression, and chronic exposure to community violence really led to the state of community violence that we see today. In developing the Toronto model, there's been a lot of movement and adjustment since Council's initial review back in 2018. Obviously, COVID had some impacts on timelines and the efforts and capacity of the different partners. It slowed some progress to an extent, but we're happy to have been able to move forward. And now we're nearing our launch, which is going to happen near the end of June. To list a few of the key actions that kind of occurred since the approval, we've been leveraging a lot of existing data, both quantitative and qualitative, from existing city programs like CCRP, Focus, TIES, and other youth violence prevention and intervention work around the city. Leveraging data from our partners like TPS, TCH, the different violence reduction strategies going on around the city. Between 2017 and 2020, stats indicated a 39% increase in incidents of gun violence across the city. Over the last year, there has been a slight decrease citywide, but an increase in the Northwest, Rexdale, and Jane and Finch. There are always different factors that can impact these numbers, trends and shifts in the culture of community violence, but it has been clearly established that the Northwest has the greatest need for some sort of intervention to address gun violence. Spending the time to really examine and understand the culture in the Northwest was key to this overall initiative. A lot of the research out there is kind of from a US study perspective, which isn't always relevant to the Toronto context in terms of its nuance. We really dug deep into that local information and pulled on and leveraged our local partners just to gain access to that information, like the different reports, one example of which is the Roots of Violence. We also looked at other violence interruption models from around the country and internationally to better understand how a made for Toronto approach could potentially look. One initiative was called Cure Violence, and that was in New York City. The city of Toronto was actually fortunate enough to get an opportunity to visit this and see firsthand, take those learnings back here to really inform how Towards Peace was going to look. Advanced Peace, also we relied on them informing how this could potentially look also, which is in California. And there's been a couple other different initiatives in the UK and as well as within Canada. Building and restoring local community engagement and community trust was a big priority with this pilot. That's one of the many reasons why this pilot had to be informed, led, and driven by community. In terms of the city's role in this pilot, the city is essentially like the backbone supports and the main funder. We provide coordination in working with the local partners who have that expertise that we really want to leverage. So through this process, there's been a lot of consultations, asset mapping, and other partnership development activities. The main partners that are involved, we have the anchor, which is Black Creek Community Health Center. We have the lead, which is Rexdale Community Health Center. Obviously, the two sites being Rexdale and Jane and Finch. Black Creek is the anchor / lead in Jane and Finch, and Rexdale Community Health Center is the lead in Rexdale. The two grassroots kind of overseen by the community health centers are Think Twice in Rexdale and YACE in Jane and Finch. Our research and evaluation team is Blueprint. Some teams that are involved in the communication initially were NIA Center for the Arts, and then later on Black Brush. And we have some consultants associated with this project like Gary Newman and some other folks, but that's kind of the core team. In terms of the public health approach, gun violence in Toronto is a health equity issue. As with other public health issues, violent injury has recognizable risks and protective factors that can be addressed or enhanced in order to reduce harm. This public health approach to violence prevention seeks to improve the health and safety of all individuals by addressing the underlying risk factors that increase the likelihood that an individual will become a victim or perpetrator of violence. The public health approach is widely recognized to be an effective way to help prevent violence in the community, and Towards Peace is going to utilize that approach. So the three kind of the 4 steps to this are essentially ongoing data collection and analysis, and this is essentially to better define and monitor the causes and consequences of violence. The next being identifying the risk and protective factors, and this is to inform the likelihood of the perpetuation of violence and pivotal points of interruption where we can intervene. The third step is kind of developing an intervention and testing it out. So that would, in this initiative, that process would kind of look like providing that case management wraparound services, coordination and support to the individuals and their families in trauma, and really taking those learnings. And then the last one would be the implementation and evaluation of the overall initiative. And that will kind of look like Towards Peace. I mean, the entire intention is to reduce the risk factors that lead to involvement in violence and exposure to violence and violent behaviors. So we will be progressing through that as we go. So essentially, the 3 methods of engagement with this initiative are first, the in-person Towards Peace violence disruption workers. So those are local individuals with relatable lived experience and expertise that strengthens their capacity to be able to connect and build rapport with these youth and their families who are involved or at risk of involvement with violence and crime. And these folks were selected specifically for their lived experience and their ability to be able to connect with those hardest to reach individuals. The second method of engagement is the eVibe program, which employs online e-mediators. And these are essentially youth with lived experience. They've been hired to identify problematic content online. So kind of tracking those risks and conflicts, different emerging trends, people expressing grief or trauma and loss, those type of things. E-mediators will also disseminate anti-violence content through eVibe program, which is going to be conducted mostly through social media. The final method of engagement is the BRAVE program, which is a hospital-based violence intervention program case manager. So essentially, through different consultations and the data out there, we realized that folks who often go into these trauma centers with gunshot wounds or stabbing injuries, once they leave the facility, they don't really have any follow-up supports. And they were noticing that even something as simple as changing their bandages could result in infection or further injury, just because oftentimes people have never been through something like this, and without any sort of supports or somebody walking them through that process, yeah, things could really go sideways. So essentially, that case manager will work with them from bedside and back into the community to support a continuum of care and safety through the city partnership, and that's with Sunnybrook Hospital. Just to kind of go through who we're hoping to reach through these 3 initiatives within the overall Towards Peace initiative. So these folks are going to be youth, which in our designation, it's ages 12 to 29. And the risk factors that we really want to be addressing are the following: access to or possession of a firearm, involvement and or connection to street level organizations or groups, mental health challenges, including PTSD, PTSS, trauma and hypervigilance, adverse childhood experiences, prior history of violence and frequent exposure to community violence, high risk of being victimized or involvement in violent acts. We really want to focus on those highly influential individuals in community who are invested in either of the pilot neighborhoods, so Rexdale or Jane and Finch. They could possibly have recent victimization in a shooting or a lethal event. That's a very big risk factor, or possible recent release from a correctional institution, likely serving a sentence for crimes involving firearms. That's our focus. And then lastly, disengagement from school or truancy. If anybody has any questions, here's my contact information here in the middle. Charlton Elliott. Once again, I'm a community development officer with the community risk intervention team here at the city. And yeah, I've been working on Towards Peace. So any questions that are towards peace related, please direct them to me and I'll get back to you as soon as possible. But yeah, that's about it from my part. Once again, if there's any questions, feel free to jump in. Just looking at the chat, if anybody, does there have to be an association with organizations or gangs to be involved? Thinking of folks involved with human trafficking. Good question. We do know that, you know, folks that are potentially involved in human trafficking often could be perpetuating different situations involving gun violence. Our focus is those that are attached to different community level organizations, gangs, if you will. But if it is human trafficking and they do have a history, any sort of history of violence, kind of going off of those other protective factors or risk factors that were mentioned, then they could definitely be eligible. Yeah. So no, they don't have to be, in short, no, they don't have to be part of a gang, but that tends to be who we're looking at. Really, it's just a highly influential individual in community, in one of those two communities. So we're really going to leverage the violence disruption workers' knowledge on the ground to kind of identify those folks. But through the referral process, we're partnering with a lot of different agencies to really be able to get to the folks that we feel could benefit most from this. Appreciate the question, Kelsey.
Sorry, can I just expand on that a little bit more? Just because I'm coming from Black Women in Motion, so we are a support program for, not a support program specifically, but we run programming for survivors of gender-based violence. And in the context of like gangs and gun violence, looking at the gender-based violence aspect of that, that's sort of the realm that I'm thinking of. Like, I've worked with a few survivors of gender-based violence and human trafficking. So I'm looking at like the piece where like adverse childhood experiences, mental health challenges, PTSS, all of these pieces. So I just want to know if I can refer these folks to this program as well.
Yeah, no, and just kind of thinking out loud, yeah, that's definitely something that could happen. We're kind of building out that referral process more comprehensively right now. But yeah, no, if you don't mind, I'd like to take your information down and we can connect a bit further on and look at that a bit closer.
I'll put my contact stuff in the chat.
Thank you, appreciate that.
And I'm also wondering as well, Kelsey, that, I mean, as we go and talk a bit more about the Caregivers program, where there's an interconnection there, because, you know, if we're talking about gender-based violence and how there are some intersections there in terms of as caregivers, because often caregivers are in that position where they are also trying to support or that their families are being impacted. So there may be, as we go to talk a little bit more about the program, the piece which is around the caregivers piece, that you may see a point at some point there of coming together. and supports that can be offered to definitely to caregivers who may be experiencing gender-based violence and trafficking. Okay. Well, thank you, Charlton, for that. Can I was just going to, can I just pull back up the our PowerPoint here, so that we can.
Okay. So actually we're at the right spot.
Was I? Yes, sorry.
Okay. All right, cool. Okay. All right, so I'll speak a bit about the Jane Finch Rexdale program, and I'll look at the overall goals, the purpose of the program, the target group, speaking a bit more about that, and partnering, our role as we partner with the agencies who are funded. Next slide, please. Okay, so the overall goals are twofold. One is to, and the focus really is on caregivers. It's supporting caregivers to build their capacity, including them in solutions focused on healing, overcoming the traumatic impacts associated with community violence. So the focus is really on supporting caregivers. And secondly, it's creating a mutually supportive environment for them to share ideas, build supporting healing networks, and strengthen community resources and cohesion and advocacy. Right? Okay. So those are the big motherhood and apple pie goals, but very specifically, this particular program has six outcomes that we want. We want to develop and implement programs and initiatives which are directed towards caregivers. Increase caregivers' access to culturally appropriate, and this is really big for us, spaces, services, supports, and activities. Sorry about the dog. To provide supports to caregivers and families who have been impacted by community violence. To increase caregivers' skills and capacity, so there'll be training and exposure to new opportunities. This piece is important to develop opportunities for community advocacy, healing, capacity building, and information and resource sharing. And finally, to promote positive messaging that will shift the narrative around community violence, because we just hear so much negative about it. So building strength in terms of how people are resilient. So those are the 6 outcomes that we want. The target groups, and I think Charlton spoke about down the road, there may be additional projects rolled out in other communities, but this particular initiative is targeted on Jane Finch and Rexdale. So those 2 communities. Bless you. And for the purposes of the program, a caregiver is a biological or non-biological family member, friend, person of choice, whoever they choose, who gives paid or unpaid care to a child or youth. So it's a very broad definition, very intentionally. Next slide, please. So who can apply? So basically, we're really focusing on grassroots groups. So it'll be, and it can even be a group of individuals who have come together. You don't have to be established. So it can be grassroots groups or emerging groups representing a collective individuals that have extensive place-based knowledge of one of the 2 identified communities. So the place-based knowledge and connections is critical. The groups will also need to have connections with caregivers in these communities. The capacity and ability to create meaningful, culturally relevant interventions for and with local caregivers, focused at supporting capacity building, healing, and advocacy. And we need people who are already, this initiative lasts until the end of the year, so we don't need you to begin to create relationships, because it takes a while to build trust. The agencies, the organizations or groups that do this have to already have those connections in the community. And so basically, next slide, please. The selected groups will partner with Delta Family for Rexdale and Jane Finch. And basically, we already do a lot of support for various community agencies. we'll be working with you as you will decide what you want to do, and based on what you present, you will be selected by the review panel. And so we'll support you to deliver your programs, just making sure you have what you need. If you need any support, resources, those are the types of things we can look at supporting you with. We'll help you to develop, implement, monitor, and evaluate your programs and connect with the overall, the Towards Peace model. Of course, all activities must adhere to health and safety protocols. Any questions? I think it's pretty straightforward. And this is very much a conversation. Huh? I mean, it's a very small group, so it's even more of a conversation than it normally is. So feel free to, if you have questions, as Kelsey has been doing, to put them in the chat or just ask. Thanks a lot. I'm going to turn it back over to Gillian now.
Okay, thanks, Kemi. So we just wanted, for this section, we just want to go through, we should go through the request for proposal, as we say, request for proposal 101. So as I said earlier, let's have a look at the sort of budget, staffing, you know, when we talk about defining what we mean by grassroots, and costs and the application forms. So starting off, what we are saying as a group, we're not looking for you know, large organizations. We're saying an annual operating budget of up to a maximum of 100,000, which is kind of nice. So, you know, even if it's a new group that's come together and you have no budget, that's fine. But we are saying up to a maximum of 100,000. And then we definitely, you know, we're looking at no more than one full-time paid staff or 2 part-time leaders. So, you know, or the group can be entirely voluntary based. So as Kemi said, you know, emerging groups, it could just be a group of individuals who feel that they want to address these issues in their communities. It's something, you know, they've been supporting, and often caregivers are overlooked in this process, and this is why it's so important for families. This is about supporting the families. So this is why we're kind of trying to stress that, you know, we're looking for new and emerging groups. So the expectation for the groups would be to deliver on sort of program design, program delivery, capacity building with caregivers, outreach, community engagement, and as Kemi said, engagement, you know, regular engagement with Delta family and at times maybe with the City of Toronto. And also documenting and reporting on their outcomes. And we will be providing support through Delta, we'll be providing support to the group in the documenting and reporting piece. So what are we looking for in terms of grassroots experience? So yeah, obviously place-based experience in the Jane Finch or Rexdale communities. Demonstrated extensive and recent, within the last 3 years, experience of working with caregivers and families of young people most vulnerable to involvement in serious crimes and violence and crimes, and supporting their families. Some knowledge of the justice system, risk factors, causes and consequences that are impacting families at high risk. Extensive and recent experience working with caregivers of Black, Indigenous and people of colour, so BIPOC children, youth and families. Lived experience of the issues faced by BIPOC families living in low income, over policed communities. Lived and working experience of living with, experiences with families and with youth who are involved in serious violence and crimes. So gang involved, incarcerated and or previous involvement in violence. Deep roots and good standing relationships in target communities of Rexdale or Jane and Finch, and an understanding of anti-oppression and the impacts of racism and imperialism on BIPOC communities. So that sort of context is important. So thinking about what the funding will and won't cover. So what's eligible? So, and we are looking for 2 to 4 groups, and we're looking at funding between anything from 15,000 up to 40,000 for each of those groups. But this is what will be covered, can be covered with the funding. So staffing, permit costs, liability insurance, honoraria, training and recognition, rental fees, so for space, transportation, TTC, transportation, childminding, equipment rental, artist fees, food, supplies and material, interpretation and translation, evaluation, minor capital costs, such as, you need to purchase a computer or maybe, tablets. And then we'll also cover overheads and administration up to 15%. So what's not, what's ineligible costs? So what the fund will not cover: special events costs, such as awards, ceremonies, banquets, retreats, receptions, activities that extend beyond Toronto's boundaries, so without prior approval from the city, religious activities, services, partisan political activities, subsidies, individuals or otherwise, fundraising events, walks, runs, other donations to charitable causes, reserve funds, debt repayment and/or deficit funding, capital costs, including building repairs or renovations. So none of these will be covered through the funds. The application form, I don't know if folks have actually had a chance to look at the application form, but we just want to take you through the actual form itself. And if you have any questions, do let me know. So basically with the form, what we're asking for is just tell us who you are, your name, and then we'd like 2 key contacts for the group, and with obviously names, phone and emails, and what their role is within the group. And again, it doesn't have to be a formal role. We just want to get an idea of who's doing what. Sorry, I'm jumping here. Group structure. So we asked here, select the organization type that best describes your group. So looking at, are you a recently formed group? You are a new informal grassroots group, but not registered as a charity. So still less than 1 year. An informal group not registered as a charity that's been in existence for 1 year or more. A charitable organization or a public foundation registered as a charity by the Canada Revenue Agency. So we're trying to distinguish between the different types of groups there are. And then if there are any other types of, if you don't fit into any of those categories, just let us know there. So, and here we're asking you, who is, who are your core members? So we've listed here a number of possible, Black, Indigenous, how do your members self-identify? South Asians, newcomers, two-spirited, lesbian, gay, bisexual, transgendered, queer, racialized individuals, living with disabilities, youth, 13 to 25, caregivers, or none of the above. If there's another category, another group, please, again, let us know. So, am I going back? No, there we go. Sorry about that. I think missed that out. And yes, just here, I think I said this. No. So what's your annual budget? So we just want to get an idea of what your budget may be. And like you said, if you have no budget, just put 0, that's fine. Describe your staffing structure. Are you volunteers, full-time, part-time staff? And then where you're located. And you may not be located in those areas, but you may be serving and maybe working with residents within the 2, but we would like to know where you actually located in the city if you're not in the Jane and Finch and the Rexdale area. Okay, familiarity with the identified neighborhoods and challenges they represent. So here, what we'd like to hear from you is, identify the community in which you plan to do the work, just 10 words. Tell us about your group's connections to the identified communities, 300 to 500 words. We just want to sort of try and keep it as concise as possible. Tell us about your group's experience of working with caregivers of Black, Indigenous and people of color, children, youth and or families, with a maximum of 250 words. And then tell us about your group experience of working with families with youth who are involved in serious violence and crime. So that will give us a bit more of a picture of like who you're already connected with and your understanding of those communities. So number 4, we're asking you to share with us your program ideas. So what are your goals? What are your group's goals for this project? Describe your group's program ideas. How do you, and we do have attached to the application, there is actually a work plan and a budget sheet that, we'd like you to complete as well. Let us know how you plan to reach your intended participants, and then list your intended outcomes. So what do you hope to achieve? How many people are you hoping to engage? It could be numbers, it could be about what would you like to see the outcomes? How would you like your work to impact the lives of those who are you're engaging in your program? And then tell us about how you will evaluate your program for impact. Finally, we are asking for 2 references from the community who can tell us about your relevant experience with caregivers and your work in the communities. And again, if you can just provide us with a name, email, and phone. So this is a bit of a timeline that we have. We launched on May 10th. This is the second of our 2 information sessions, but there'll still be opportunities for others. I mean, you may go away today and you might think, well, actually, I know somebody, or I know a group of people in my community who may be interested in this. Do let them know that they can reach out to myself either by email or by phone. I'll make my phone number available if they want to talk through, they're interested in applying and they want to talk through a little bit more, want a bit more information. I'm available to do that. Our closing date is May 20th, which is Friday. It's coming Friday. And then in June, we will be meeting, we'll have a review panel that will meet and we'll look at the applicants and the decision will be made in June. We're looking to roll out the program July to December, January 2023 is our sort of end date. But, we definitely would like to sort of see things happening over the summer because we know the summers are always our, most challenging times for our communities. Okay, so any questions at this point? Any thoughts, any questions?